So I'm just going to do a quick introduction here because we want to get to our amazing speaker. It is just such a pleasure to welcome Dr. Seye Abimbola to University of Washington, the Global Health Department. As many of you know, or maybe all of you know, he is truly one of the leading voices on decolonizing global health, on equity in global health. In addition to his own global health research, he has been outspoken. So I am going to give a brief introduction so you know a little bit more about him. Dr. Abimbola will talk, and then we're going to have some Q&A at the end, and it's a small enough room that we can, I think, be very interactive and engage. And I hope, a lot of you saw the event yesterday, which was amazing. So it'll be kind of a continuation of that discussion. Dr. Abimbola is a health systems researcher from Nigeria. He is currently based at the University of Sydney in Australia, where he is associate professor, where his teaching and research focus on knowledge practices in global health, health system governance, and the adoption scale-up of health system innovations is his focus. Dr. Abimbola was awarded the 2020-2022 Prince Claus Chair in Equity and Development at Utrecht University in the Netherlands for his work on justice and global health research. He has been the editor-in-chief of British Medical Journal Global Health, BMJ Global Health, for 9 years and just stepped down in March, unfortunately for us, since we all wanted to talk to him about the papers we have under review. He has, in addition to these accolades, he is, and I'm going to say this wrong, the Radulovacki Visiting Scholar at Northwestern University currently in United States, and it just flew in from Chicago from there. And he has a book in the works, a collected volume of old and new essays titled, quote, The Foreign Gaze Essays on Global Health, that will be published later in 2024. So I imagine we're all going to be teaching with that text in our classes. So he has written extensively on decolonizing global health, uses of knowledge in global health, the foreign gaze, epistemic violence, among other major themes. And he most recently was co-author of a powerful critical critique of the Lancet Journal that was published in the Lancet itself, called The Lancet and Colonialism, Past, Present, and Future. And that is generating lots of discussion. We talked a little bit about yesterday. Maybe we can get more about the drama behind the publication of this hard-hitting article. It was, because it's such a good piece, it generated some resistance. So today he's going to be discussing unfair knowledge practices in global health. Please welcome Dr. Abimbola. One final note, the reason why Dr. Abimbola is here is because of the fine work of Dr. Ferdi Mukumbang, assistant professor in global health, that happens to know Dr. Abimbola quite well. He went all the way to Australia to say, you've got to come to Seattle. So thank you to Ferdi for bringing him here.
Yes, thank you very much for having me, and thanks, Ferdi, for convincing me to come. He came to my house in Sydney one evening, almost unannounced. And thanks for the hospitality so far. I've enjoyed my brief period so far here, and I look forward to more Ferdi's wife's West African cooking. I had some last night, and I'm looking forward to more tonight. But yeah, to the business of the hour. One of the most challenging things about experiencing injustice often is that when you experience injustice, you then have to speak up about it and make an argument and explain why it is unjust. And when that injustice is about knowledge, it doubles the amount of burden it places on you to explain yourself, because you were not even believed in the first place, or you've been wronged as a knower in the first place. So there's an additional burden on you. There's this line from Baldwin, which I think about a lot, where he said that the victim who is able to articulate the situation of the victim has ceased to be a victim. He or she has become a threat. And that, for me, speaks to the nature of epistemic injustice, which is the kind of unfairness that is done to a person or a group of persons in their capacity as knowers or interpreters of knowledge. As I highlighted earlier, they are difficult to articulate. And they're difficult to articulate for the reason that I mentioned, which is that you are already in a position where you have to struggle to get yourself heard. And so in many ways, I found that even the idea of epistemic injustice itself, which I, for reasons of accessibility, call unfair knowledge practices, even the ability to name that is justice affirming, that we have a label for it, and that we have a way of thinking about it itself takes us closer to the goal of being able to speak, and by so doing become a threat to the source of the injustice. Now, you may have noticed, and I suspect most of you have noticed, that there's been a lot of discussion in the global health literature in the last sort of 5, 6, 7 years. And I have broadly referred to, I initially started to call them the complaints literature as a joke, but now it's a serious thing. I call them formally the complaints literature. And it makes me happy, in fact, that this literature exists at all, because it's a form of that raid on the inarticulate. And that's a phrase from the poet T.S. Eliot, which I like, again, to think with on this topic. Now, it took so long. I mean, global health as a field has existed for decades, and some may even say it's a century if you change the label you put on it. But it's taken so long for people to start to articulate what is epistemically wrong at its core, the way that people have been able to do in the last 5, 6, 7 years. And for me, I found that it would be important to find a way to consolidate that complaints literature. And hence the need to almost synthesize it and give it some further shape, beyond the fact that there are complaints about different things spread out across different journals and being written by different people from different standpoints, often about different things. But at the heart of them, you'd find that there is a complaint about a knowledge practice that people are bothered about. So that's what I'll be talking about today. It's an exercise in synthesis of a chunk of that literature. And I'll be describing that exercise using the framework of epistemic injustice that was developed by the British feminist philosopher Miranda Fricker. Now, later, in about 2 slides, I will explain modifications of that framework that would allow us to do justice to this complex literature. But before we do that, I think it's important to first lay out how we might think about what global health is, and perhaps also think a bit more clearly about the epistemic problem at the very heart of it, which is the problem of distance. That any efforts that any one of us might embark upon to reduce inequities will have to, by definition, be an effort that is enacted across a distance. Now, that distance is often a physical one. You are in Seattle and you're working in Kenya. And sometimes it's a social one. It's an epistemic one, as it were. It could be because of a difference in income, difference in status or class or culture or caste or faith. Different things create that distance between people. And so at the 2 ends of that distance, I use the label center and periphery. So the powerful actor who is doing global health, as it were, is at the center. And the less powerful actor on behalf of whom global health is being done, is at the periphery. Now, in this formulation, the center has power, hence the ability to even do global health in the first place. And the periphery knows better, given that it's actually where the action and the problem and the issues are to be addressed. Now, the problem in global health, which I hope is not foreign or strange to you, is that we often assume, those of us who are at the center, and I call the center on this slide place B, or in situation B. We assume and often imagine that whatever will work in place B or situation B will work in place A or situation A, which is at the periphery. And so we would impose it very often. Or that the ways of seeing the world and understanding the world and making sense of reality in place B or under situation B would also apply in place A or situation A. And so we apply it. Now, of course, as I said earlier, because the people at the center have power, they can apply, they can impose. I should stop saying they. We can apply and we can impose. And those who are at the periphery know better, but do not have the power to say that that doesn't work here, it doesn't make sense to me. And even when they say that, the people at the center may not even hear, which is part of the challenge of articulating that situation of being a victim of epistemic injustice. And there's a fine, beautiful line. I love these two people greatly. And I like that they are smiling in this photo. But there is something that Baldwin said, and this is only the second of, I think, 4 mentions of Baldwin in this talk. He said that ignorance allied with power is the most ferocious enemy justice can have. And that is in many ways the summary of the previous slide, right? That when you have the power and you don't know enough, you break things in all sorts of ways. And you may not even know you are breaking things. And when the people who experience the consequences of you breaking things tell you, you often can't understand what they're saying, or they are not in a position to tell you that you are breaking things. And so in many ways, our analysis or our studies, our interventions fail to respect the dignity of people in place A or situation A as knowers, people at the periphery. And while I will be using the terms center and periphery, it's also important, I think, to note that these are not natural categories. They're not necessary and neutral categories. They are categories that exist because the world is by its very nature unjust. Right? And I like how Toni Morrison talked about how in her own work as a literary novelist and writer, she said that I stood at the border, which is at the periphery, stood at the edge and claimed it as central, and let the rest of the world move to where I was. In other words, that state of being at the periphery can be resisted and can be pushed back against. And people at the periphery can and should be able to claim that centrality for themselves. But often in a field like global health, the center has to allow that to happen in some shape or form. And again, this idea of center and periphery and the periphery claiming centrality for itself is true for individuals as it is true for institutions and platforms on which we share and move and curate knowledge. So we're returning now to FRICA's framework. Now, FRICA, in defining what epistemic injustice is, which is the kind of injustice that is visited upon people in their capacity as knowers, and interpreters of knowledge. She identified 2 forms of epistemic injustice. One is testimonial injustice. Don't try to read the thing on that figure. And the other is interpretive injustice. And she describes testimonial injustice as being preceded by a credibility deficit that is listed on people who are marginalized, and interpretive injustice being caused by interpretive marginalization. Now, with this formulation, I add 2 additional qualifications. One is that these injustices can be visited on a person in their role as a speaker, in their position as a knowledge maker. And I describe that as pos, or positionality, as it were. It could also be visited on a person or a group of people in their position as the hearers, right? Or the audience, or the recipient of knowledge that is generated. And in that, I describe that role as the gaze, which is the power that one may wield in their position as audience of knowledge. Another qualification on FRICA's framework that I think is important is that while FRICA often spoke about these injustices as being interpersonal, as being at the individual level, I think about them more, in fact, as being institutional. So these injustices can be visited on people as in their role as individuals and groups, but also can be visited on people in their role as functioning within institutions. And the institutions themselves can be so arranged that they default to being epistemically unjust. Right? And knowledge platforms, like academic journals, like books, like publishing houses, can also be, by definition, epistemically unjust, given the rules that structure how they function in the world. Right. So credibility deficit is when people at the periphery are not seen as credible producers or audience of knowledge. And I put audience in red because that's something, a layer added onto that framework. And interpretive marginalization happens when interpretations of people in place A or situation A is not what shapes analysis about them or interventions listed upon them. And these kinds of injustices are inflicted on people because of whom they are, not because of what they know. In other words, regardless of what you know, can know, should know, be able to interpret, that is not what influences decisions made about those people, but rather that whom they are, where they are in the world, what people expect prejudicially them to be able to know or do. So back to the synthesis. So what we did, if you're familiar with this literature, the bulk of it is not research papers, right? The bulk of it is commentary, editorials, analysis, some of them extended, some of them really short. So we're not doing the traditional review where you sort of go into PubMed and you type search terms and you look for stuff. We identified instead 12 journals where we knew the complaints literature had been really well published. And then we identified a few more journals that we thought were more peripheral geographically to the center of global health. And of course, only 10% of the papers we identified were research papers. And they were almost all papers analyzing authorship distributions, which has been the form of unfair knowledge practice that has been most described in the research paper format. Others are far more difficult to get at as research, quote unquote, because they're more difficult to count and put numbers to. So 2 global health journals, you can easily guess which ones they are. I used to edit one of them. So BMJ Global Health was one of those, and Lancet Global Health was the second one. And then we also identified 2 social science journals. One of them was Social Science and Medicine, which is a very old social science journal in the field. The other is Medicine Anthropology Theory, because we also wanted to go specifically for anthropology papers. And then we identified 8 regional/local journals. And we picked at least one from each continent. So there's the American Journal of Public Health, and there was the Australian and New Zealand Journal of Public Health. There was the Indian Journal of Medical Ethics. There was European Journal of Public Health. There was the Latin American, I can't remember what it's called, but it's a PAHO journal. Which other one was there? There was the Pan-African Medical Journal. There was also a South African Journal of Bioethics and Law. Have I gotten to 8? I think so. Because I can't remember any other one. So anyway, the 2 global health journals, not unexpectedly, had about 3/4 of all the articles that we identified. And then about 10% of them were in the social science journals. And because of their larger number, the more regional and local journals had about 16%. So in all, we had 141 papers. Again, we weren't surprised that it was that number. We had about 6 people do the reading of each one and coding of each one. There was several rounds of coding. The first one was really basic, just text, and then we started to reinterpret them theoretically and fine-tune the theoretical interpretation with each round of coding. Now, because Ferdy is here, I assume many people here have heard of realist methods and evaluation. That's in addition to being from neighboring countries, we share that in common, that we are realist people. It feels like a little club, but I think it's growing, and we are very evangelical about trying to get more people into our fold. But the basic logic of the realist method is not foreign at all to how we think about the world, which is that for every outcome you see in the world, for every manifestation of anything on the surface, there are things underneath that we can't readily see, but we know are generative of those things we see on the surface. A useful way to think about those things that we can't see is this structure of society, which is more visible. But the other one is the agency, the what happens in people's heads often, how they respond to those structures, how they make decisions because of that, and how they interpret the world and function because of it. So realists call those two things context and mechanism. So context are the social structures within which we function. And those structures can be rules that govern our behavior. They can be organizations. They can be other forms of constraints on human behavior. And then mechanism are the reasoning and the resources that we bring to the reasoning and to those structures. And then the outcomes are the things we do that often people can see, but are determined by those two things under the surface. Now, one of the reasons why I think we are successful at preaching this message, Ferdy, yes, is that it's not too complex to understand.
Very complex.
Yeah. So that sort of image explains it a little bit what I've been trying to describe, but it's that basic logic, right? There's context, there's mechanism, and those two things working together generate outcomes. And when there are interventions, often interventions work on the context or on the mechanism or together, right? And then working in that mix generates a pattern of outcomes that we can then try to explain by looking back into what had happened with mechanisms and what had happened with context. But for this is a far simpler form of what Ferdy does, which is just using this framework and this logic to look at the complaints literature. Now, it's often difficult to understand what's going on at the level of mechanisms. But for this exercise, the inspiration for how to think about the mechanisms came from this 12, 13-minute exchange. You can find it on YouTube. And I encourage you, if you have never watched it, to watch it. The entire 13 minutes, 12 minutes, 50-something seconds. It was an exchange between James Baldwin and Weiss, who was a professor at the time at Yale. And it was a very interesting exercise in epistemic injustice. All the forms of epistemic injustice that I will talk about today, you can find in that video. In fact, I've set it as an exercise, as an assignment for my students to code the exchange and identify different forms of epistemic injustice going on. But what was going on in this exchange was this man, Weiss, was saying to Baldwin that racism is not a determinant of anything in American life. And Baldwin was trying to use his personal experience and his analysis of the experience of African Americans in this country to let him see what was going on. And he just wouldn't see it. And if you watch the video, there were moments when the man was just almost torn, physically torn, and then fold his hand, and then because he was at the, yeah. Watch the video and you see what I'm saying. But at the end of it, and Baldwin is one of the most articulate human beings ever, right? If you read Baldwin or watch Baldwin speak, this guy can articulate. And it took him 10 minutes to get to the point where he nailed it, right? So he nailed it at about 10-minute point, and he nailed it using this argument, right? That I don't know what white people in this country feel. And this man was saying, this country it's okay, everybody struggles, what's the problem? He said, I can only impute what they feel from the state of their institutions. And he listed 4 institutions. So there's a white Christian church and there's a black Christian church. And he quoted Malcolm X there, who said that the most segregated hour in American life is high noon on Sunday. And then he mentioned labor unions and their bosses, because he's not in their unions. He mentioned real estate lobby that keep him in the ghetto. He mentioned the Board of Education and the kind of schools his children have to go to, and the quality of those schools and the books that they have to read. And he said, well, you may not hate me, but the nature of your institution tells me otherwise. Hate me. And that is the strategy that we use in this analysis to get at the mechanism. That what is the nature of the institution? What does the institution say about what is going on in people's minds, whether as individuals or as a structure, or as the rationale that had been baked into the agency of institutions? Now, before I describe the results, I would also mention something that colored how we were interpreting the data, which is that in thinking about what how an individual or an institution might be epistemically unjust. A core element of the harm done to people is done to them in their capacity as knowers, and that as human beings, one of the things that entitle us to dignity as human beings is that we are knowers. So if I violate your dignity, or if I violate you as an epistemic agent, I'm also violating your dignity as a human being. And this explanation comes from the work of Kwame Anthony Appiah, who is a Ghanaian, American, British, it's all over the place, philosopher. And because we know things, we learn, we make sense of what we know, we interpret our realities and the systems within which we have our being. Now, if this feature is not respected, it means that one's dignity as a person, one's knowledge platforms as disregarded, then one's dignity is violated. So again, hold this thought, because we'll return to this thought about dignity at the very end, because I think this is a very important way of thinking of what is wrong about epistemic injustice. That it's not just that someone is doing something bad to you on the surface. And often when I talk about epistemic injustice, I'm making the argument that if you are being epistemically unjust, the interventions you come up with will be bad and ineffectual, right? And your analysis will be wrong and based on the wrong premises, so you not be effective. And that's a good enough argument to make. But I think a more important argument is that even if your intervention were to be right, you would have done some kind of harm to people, right? So there are two levels of wrong going on here. There is the more instrumental one. And there is what philosophers call the deontological one, which is more about the value one might place on a person or a people as full human beings. So this looks like mathematics, but it's not. So under each outcome category, so what we did was to those two forms of things that lead to epistemic injustice, credibility deficit or CD, interpretive marginalization or IM, right? So each of them has versions that are attributable to posts or that are done to a group of people in their position as people who speak or who make knowledge. And they also have a version that may be done to people in their position as people who are a worthy audience of knowledge that is generated. So you have 4 categories there, okay, 2 by 2 table. Again, it sounds like math, but it's not math, right? 2 by 2, yeah, you can see it. So there's outcome category 1 is CD related to post. In other words, when a credibility deficit is visited on the people in their role as people who make knowledge, right? So we identified 3, again, I promise you, I think this thing often happens to me, right? That I'm doing analysis and the numbers seem to be so neat. And this was not engineered, I promise you, it wasn't, but it looks engineered. But I like beautiful things, so this could also be engineered, but I promise you it wasn't engineered. So each category has 3 mechanisms that may lead to the outcome. So CD related to post, so the peripheries, cultural knowledge does not matter. It's the kind of reasoning that leads to that kind of outcome. A good example, I'll try and give an example at least of each of them to give you a sense of what is going on. In a lot of global health, we tend to we often describe values or things that are worthy of being aimed for, like freedom and liberty and human rights. And these values as though they were Western values. It's a very strange thing. And I think many people, and we'll get to this later, many people who are on the periphery or who are from the global South have come to believe that to be true. But if you really know your history and your culture, you know that these things are not true at all. And you see that repeated in literature a lot, almost to completely discount the fact that other people have thought about freedom. It's a strange thing. Anyway, the other people have thought about these things, and democracy, and human rights, and liberty. These things they're not Western at all, right? They're human. But there's a way in which, again, the literature will suggest otherwise. Yeah. So the second one is that the periphery's technical knowledge does not matter. And again, this we're now coming to more sort of, can they think? Can they analyze? Can they learn to do the basic stuff or even complicated stuff? And again, you see this manifest a lot in authorship, for example, or in how partnerships are set up and who gets to be the person who goes and collects the data, who gets to be the person who sits behind the computer and analyzes it. Because you see that very clearly laid out in, often. And the third mechanism that leads to CD related to post is that the periphery's articulation of knowledge does not matter. Articulation here is the ability to speak for themselves, right? Or the need for them to be allowed the space to speak for themselves. Again, could manifest in authorship, distribution, but also could manifest in, again, how a research study is set up. So that there's certain kind of people who get to speak and present and have the space to do those things. And there are people who are in the background very often. So the second category of outcome is credibility deficit related to gaze. Now, gaze, let me give you one more thing to help you sort of hold the idea of gaze completely in the head. This line by a Malian, French Malian literary theorist who said that every narration places the spectator in a position of power or agency. In other words, the fact that you are my audience today, and I can imagine whom you are, has shaped what I'm saying. And it hasn't shaped it enough so that even as I'm talking to you, I'm changing how I'm presenting myself to you. If it was a different audience today, I will speak slightly differently or very differently. Bless you. So the audience has power, right? So gaze refers to the kind of power that we give to the audience because that is how we communicate, right? So we can choose to respect certain people as audience and regard them as such, and we can choose to ignore the fact that some people are the worthy audience of the work that we do, right? So credibility deficit could be visited on people in their role as audience or gaze. So for example, when we decide whose learning needs our work is addressing, right? This often links to the idea of who decides the research question. Whose question is it? Whose agenda? Who wants to know, right? And very often it is some entity at the center who wants to know. That's why we go out and do the study we do. Because if it's the entities who are at the periphery, it will reflect in the kinds of research we do, kind of questions we seek to answer, kind of methods we use. Also, the second mechanism that leads to this outcome is which knowledge platform drive our knowledge making. So again, this is embodied very in real ways in terms of academic journals. So if I do a study in Nigeria and the person I'm trying to impress is an editor in Boston or in London, that's that mechanism at play. In other words, this choice that I've either made or has been made for me that makes me behave in a certain way when I seek to do certain kinds of studies. The third mechanism here is about scholarly standards that drive knowledge making. Again, there are ways in which I will consider a piece of evidence as being valid if I was at the periphery. And there's another way in which I might consider a piece of evidence as being valid if I was at the center. Right? And if I structure the way that I generate evidence so that it serves the center, I am almost, by definition, not serving the periphery, right? Yesterday I was giving the example of RCTs, right? That there are, it is held high up as this high watermark of academic thing. And it's just a tiny little slice of information. It's not heavy at all. Maybe that's why it's on the top. It's light. But for some reason, it's held high up, and then it sort of shapes how we think about things. So third outcome So 3 and 4 are about interpretive marginalization. So there are those that are about posts, which is again, people as knowledge makers, people as sense makers of things. So it could be in their role as sense makers of what should constitute a knowledge partnership. Again, we know that when we seek to set up this partnership, often because of who is funding us or who is our employer, there are certain rules and structures that are written into the partnership that also by default does not embrace how the people at the periphery may see a partnership working. So again, we decide that by the rules often of the center. Or how people at the periphery make sense of their problems. Again, people who are close to the problem in a particular way see the problem in certain ways. And here I often use that sort of age-old, beautiful parable of the elephant and 6 blind or blindfolded people who are trying to figure out what the elephant is like. And I often make this joke that the people at the periphery, think of them as 5 of those 6. And the person at the center who comes in as 1 of those 6. If 5 of them could talk among themselves, they will figure out what the elephant is like. And if the person at the center does not talk to them, they will be absolutely sure that it's like the wall because they can feel the side of it. And they will insist to the other 5 that it's a wall. You don't know what you're talking about, right? And that's often how we do global health, right? Again, people at the periphery know better by virtue of being closer to the reality. The third one is very similar to the second one, but it's how they make sense of social reality, of the world, of their world, right? Of the complexity of life, of culture, of relationships, etc. Which again, the ways in which we defer to how the center understands things often does violence too. The fourth outcome is to do with interpretive marginalization that people may suffer in their role as worthy audience of knowledge. Now, the first form speaks to how it is often how the center understands the world, that we then frame either our analysis so that it fits into a certain existing framework, right? Because if it's how the periphery understands the world, we will realign how we are presenting our work, how we are doing the analysis, and what we prioritize and place first or second or third will be shaped differently. And the frameworks with which we understand the world and the reality that we are analyzing will be different. The second one has to do with the center's social sensitivities. And this plays out a lot in how we choose to go gentle and go soft because we don't want to offend people at the center. There was a nice article that was published about a couple of weeks ago in the American Journal of Obstetrics and Gynecology, where I think about 10 or more people were complaining about the term obstetric violence. And they were saying that the term is too laden with emotion. It makes people, they didn't say powerful people, but powerful people, feel uncomfortable. Can we drop the term and just say mistreatment? Because that's this mechanism at work. It's saying that powerful people do not want their emotions ruffled. So go gentle, be soft, and we're all going to be happy. Right? And that happens a lot in global. That's just one example that is top of mind for me. Yeah, including, of course, part of the gentility also, of course, is the fact that the powerful people may be the ones who have put the money on the table for the work. And you don't want to ruffle the feathers. And they can tell you that, don't go there, don't use that term. If you use that term, it's too harsh, and you may offend the big funder. Right. Again, that happens a lot, I'm sure. Those of us in this room know a lot about that. The third mechanism here is about status preservation, right? Which is different from the second one. The second one is about how you feel, right? This last one is about how you want to preserve your position in the hierarchy of power. So, for example, this takes our attention away from analyses that speak about structure, about politics, about unsettling power, because when you speak about that, those at the center who hold power will sort of say, again, go gentle, go soft, take your attention away from that structural part and focus on the downstream things. Let's just make sure we give some money to some people and everything's going to be fine. Or just those focus on the interventions. Don't talk about politics, because that doesn't make me happy. These are all forms of ways in which epistemic injustice manifests in the work that we do. Again, going back to the beginning, I often make this point that the authorship thing is easier to see and measure and count. But all these other ones are the things that determine what we actually do in the work that we do, and that default us or make our work very often unjust. But they're far more difficult to count, although I promise you I'm trying to work on how to count it. But they're far more difficult to get at conceptually, but also in terms of articulating it. It's part of the point of this exercise, that trying to put a label on these practices, trying to put a label on these rational and reasoning processes can take us a bit closer again to unsettling these entrenched injustices. Now, on the context front, one of the challenges we had in this analysis was that all the contextual categories were bouncing off of each other.
Yeah.
Right. It was impossible for us to neatly delineate them and delineate how they affected mechanisms. Right. So we had to sort of create this wheel, and anything in this wheel could be at any other position. Right. But all the entities in this wheel are working together. They mutually overlap, they reinforce one another, and they often depend on one another. Yeah. It feels like church. I grew up in the church, so my head is always in the church. And I thought I was going to do an exercise. I hope no one here has heard me talk about this before. The first contextual category we called compounded spoils, right? And it's this situation in which those who already have tend to get to have more, because they're in a position to keep compounding whatever it was that they already have, right? So it's that sort of dynamic. And the line that took us closer to that was this line from a song by an American jazz singer. Doesn't anyone know who this person is? Them that get shall have, them that not shall lose. But that's what the Bible says. Papa may have, Mama may have, but God bless the child whose God is on. Billie Holiday. So that's the first one. The second one is colonial mentality. And this line, I know the West Africans in the room will actually know this one. Yeah. This line is, them don't release you, but you never release yourself. Who knows who this is? Bless you. Yes. And this is, again, the idea of how what the colonialists taught you keep on acting in your head and replicating and keep being active. The third one is about education. And the miseducation of, can fill that blank. It's an album title, one of the biggest albums in the world. Bless you. Yes. Miseducation of Lauryn Hill. So this is a Lauryn Hill line. And again, especially miseducation as to the origins of inequities. As I was describing earlier, there's a way in which our education diverts our attention away from the real structural upstream causes of things. And so we are taught to keep trying to fix things on the edges and never to think about what is actually really at the source. The fourth one is mislabeling, which again sort of works in a very similar way to miseducation, in how we choose to put categories on things in ways that may obscure our ability to really see that thing or stereotype them and confuse our analysis. An example of this is when we say low and middle income countries. Sometimes that category makes sense. Some other times it just doesn't make sense, right? So LMICs have nothing in common, right? They don't. Sometimes you may want to analyze something and you have something to say about LMICs, but often they don't have nothing in common. or when we say that people are vulnerable people, because people are not, it's not a natural category. People are made vulnerable, right? So there are those ways of framing things that just direct our attention, our mind in a particular way, and and takes us away from other places. And those things we are educated to think that way. Sometimes it's colonial mentality at work, and sometimes it's because some people have the power that they continue to have more of to determine how we think and shape up the way we think about the world. The fifth one is under governance, which is the notion of whether there are rules to govern knowledge partnerships, right? For fairness. And again, when I hope there are no bioethicists in the room, I'm about to shit on them. For me, one of the problems with unfair knowledge practices in global health is that the way we think about ethics does not touch anything I've mentioned so far. So if you talk about ethics and how you are trained in ethics, it doesn't touch on any of these things. And for me, that is part of the undergovernance of global health for fairness. That we have to find ways of extending how we think about what is ethical and what is fair, that then become almost codes by which we can hold ourselves to account, and we don't have that yet. The last one is underrepresentation, which again is something we talk about a lot and is far more present on our minds, I think, in this context. But also thinking about representation not just as decoration, right, but as influencing what becomes the rule that we hold ourselves to, and how we get to make and change those rules and monitor and enforce them, right? Because the point of having people at the periphery being influential at the center is for them to be able to constrain the center in how it relates to the periphery, and not just to decorate the center and give a false impression of inclusiveness. So that's the six things around the ring of context. And this is what the whole thing looks like, but don't bother. That CMOs, I just like that it's neat and clean. I like things to look pretty. And that's the point of that slide. But so when we think about undoing unfair knowledge practices, right? For me, it's about undoing those contextual categories. So we're thinking about them one by one, as I've described, and asking ourselves, what can I do in recognizing that because I have power, I attract more power, right? And so to be conscious about ceding the power, to be conscious about ceding that centrality, whether as individuals or as institutions or as knowledge platforms upon which we function. Again, colonial mentality is, again, taking very seriously the need to think carefully about education and socialization at the periphery. I often make this joke, and I'm sure Nigerians in the room are familiar with it, that we were taught that the most important river in West Africa was discovered by a Scottish explorer called Mungo Park. And we believe that. Seriously, I mean, it was in the exams. It was in our head. And when someone tells you that, and you believe it, you're also saying that your ancestors were not human.
You didn't know about the river.
Yes, that is what you have been taught, and you believe that, right? Anyway, so all these things that have been put in the heads of people at the periphery, whether again it's a physical periphery or a periphery of social status, thinking carefully about how to undo that is how to undo unfair knowledge. Third one is miseducation. Again, thinking carefully about how we educate people in global health, master's level, doctoral level. How do we educate people so that they are primed to avoid unfair knowledge practices, but also they are primed to think upstream? Because I think one of the big gaps in public health and global health education is that we are not trained, and we are not training people to think upstream enough. And the way that I often describe this is if you read the literature, you would think that the most important decision makers and the most important channel to impact is from researcher to policymaker. Right? We almost all assume that we are working for policymakers. But what would the world look like? What would the literature look like if we thought we were working for activists? What kind of research questions would we ask? Well, it would be a different setup. And for me, that's the kind of shift that happens when we take that miseducation seriously, and we start to focus more on structural change rather than just tinkering around the edges. Again, mislabeling, I gave these examples already. How do we think carefully about the labels we put on things, we put on people, we put on analysis that obscure the real causes of things, or that obscure and place blame on people who should not be blamed for their lot, because the blame belongs somewhere else. Again, on the governance, how do we begin to work towards having a different rules that govern our engagement, and also have structures to constrain us to abiding by those rules? And representation, again, very well talked about. Now, my sense is that our efforts to change those contextual conditions would often require our ability to articulate the mechanisms clearly, right? Which is, again, part of the reason for this exercise, that we have to be able to say what is wrong about a knowledge practice that is wrong. And what I've often noticed is that for various reasons, we are often not clear enough. And because we're not clear enough, we're not forceful enough. Because we're not forceful enough, we don't build that coalition strongly enough to push for the kind of change that we want. So I think this 12 mechanisms, and more may join, can allow us to do that work of really being clear in how we articulate what is wrong and unfair about a knowledge practice. But also important, as I mentioned earlier, to bring what is wrong for me back to what is human, what is worthy of dignity in everybody. And one of those features that we have as human beings that cry out for respect is that we are knowers. We are not people at the periphery. They're not empty vessels waiting for us to dump our little knowledge into. They are knowers. And just by virtue of recognizing that as being interwoven with all those mechanisms that I mentioned earlier, can put us in a very good place to either articulate and make a strong case for change, or to help us think more clearly about what it is we are trying to do in our own personal capacities to undo different features of that context. And that work just came out in the accepted manuscript version a couple of days ago, or 3 or so days ago. So the final version should be out in a couple of weeks. And I think you should read it, because it's more interesting than me talking. Yeah, and then, yeah, so my co-authors are a bunch of friends. So this work started when I was Prince Claus Chair. And so that they put a big chunk of the money, which I didn't ask for, but it was grateful to receive, to do the work. And that was a lot of us, including my colleagues at the University of Sydney. And also the end of the work, and the work continues, but the end of the work was funded by a fellowship from the Australian Research Council to work on dignity-based practices in global health, which is the continuation of this work into other little pockets of efforts to think clearly and advocate specifically about the kind of change that we want. Thank you. Yeah. Okay. I've been asked to ask you to ask me questions. Yes. Scott Ayo has a big festival in Lagos. Yeah. Yes.
So the engaging communication or interaction is a two-way process. So I know that we talked about the center and periphery, and both have responsibility. I think also the periphery has responsibility in the state in which it finds itself. So what would you say was the breaking point of dignity at the periphery to allow all this? But I believe that if we are undoing the colonial mentality of global health, not having a blame game, it's good to also identify what factors led to that loss of dignity at the periphery.
if I heard you correctly, let's play this game. So I said center and periphery. And in defining those two entities, I said that it could be a physical distinction or it could be social. And a thought experiment that I often encourage people to play through is to think about center and periphery in terms of gender. So let's assume, and I hope that you agree with me, that the center of how a lot of the world works is male and patriarchal. And let's assume that women are on the periphery of that distinction. If we took that as our thought experiment, there are ways in which we won't hold women responsible for what men do. And that's how I often think about this. Now, there are times I know if women are talking to women in women's space, they can talk about how this is what we need to do differently and do better. This is how we need to, relate with these men and do blah, 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 blah. But as someone who stands apart from that relationship, I will refrain from saying, these women serve. This may sound like Nigeria. These women serve. Look, they don't like each other. See, they're always fighting each other. That is the problem they have. If someone said that, I would say, keep quiet. You don't know what you're saying. Again, that's not to say that women among themselves cannot decide to analyze certain things in certain ways. But that is not, as a man, my position. So let's come back to the periphery in a physical sense. Right? So when I look at a place like, Nigeria or Kenya or Rwanda, as a Nigerian, I can forever talk about what is wrong with Nigeria. Right? That we Nigerians we're good at that. But if a British person comes and tells me what is wrong with Nigeria, I will say, get out. So it's for me that dynamic is important. If I heard your question correctly, there are problems, there are aspects of Nigeria that we should hold Nigeria responsible for. But there are aspects of Nigeria's fate that is beyond the machinations of Nigerians. And again, holding those two ideas together in one's head is an important thing to be able to do. I know you have a comeback.
Are there more questions?
This is the real question.
Okay.
How to be brave when you're in the periphery. I think it's, I know, courage comes, power, sometimes power can be age, sometimes, nothing to lose or something like that. But how to be brave? How can our students and young scholars be brave such that they can, in their periphery, pull away some of the things from the center and create their own center? So how to be brave in this moment?
The way that I understood my role as editor of the Global Health Journal was to say things so loudly and so strongly that other people would not feel the need to be afraid to say it, right? And to allow people saying things like that to be published so that it becomes easier, and I hope much easier, not just slightly easier, for other people to say the same thing. To be able to say the same. I worked for several years in public health in Nigeria at the National Primary Health Care Agency. And with there's a global health ecosystem in Abuja, especially, but across Nigeria as well. And one of the things I noticed was people sort of biting their tongue and not willing to sort of speak out, sometimes not having the language to do it or the framework to make the case. And I have a friend who's still in Nigeria with whom she'll say, global health scam people have arrived again. And she calls it scam. But anyway, and what I've noticed in the last few years is an increasing ability to speak back, including within government. I can't say a lot of things that I know, but I know people within government now are speaking back far more than they did 10 years ago. And I hope it increases. There are countries in the world where, because of the nature of their government or the boldness of their government, people are far more able to speak up and push back. And for all the critiques one might have of Rwanda, Rwanda is one such country, right? Where there's an environment where people who do global health can say, we don't want your intervention. We don't want your study. And what happens in those places is that they come back and willing to listen, right? Which, again, I wish other people can observe and learn from. That pushing back often doesn't mean that you don't get that thing that they are bringing, but you get it on your own terms. And sometimes as academics, as scholars, I think there's a tendency to be afraid of a phantom, of things that will never materialize. And I often encourage people just push a little, see what comes back. If nothing, push further, see how far you can go. But because I think it's worth trying. Again, I see more and more people doing that now as well, which also gives me some joy.
Yeah, I have two questions. One, I know we've spoken about, how the periphery can be brave, but I was wondering if you could also comment on what the center needs to do, because if you're on the periphery, it's exhausting. It's exhausting and it's a lot of labor, mental, emotional, physical, psychological, all of that labor to have to constantly be brave and fight. So what really is about allyship and responsibility and ceding power that the center needs to do? My second question was, I think now I started becoming very uncomfortable with the use of decolonization and how comfortable the center has gotten with subsuming everything under decolonization and erasing so much genocide and violence and taking away dignity. So what's that next step in that language beyond? Is it justice? Is it equity is also become subsumed under that? So what's that next step beyond using that language?
So to your first question, the point of having this kind of conversation in this kind of space is that's precisely that, right? I teach in a high-income country, university, in the US to do similar with a bunch of students at Northwestern. And the point is to do that compounded spoils part of the context, to place it on people's mind that you have this power that is programmed to increase. And what are you going to do about it? And it could take different forms in different spaces, but we have to keep articulating it that way. On the decolonization part, so this is my reflection on the term, and you may notice that I've not used the term at all today, right? So I tend to not use the term. But I've been glad that the term became a thing, and that it is a thing. And I'm glad because it serves that function of reducing interpretive marginalization, right? And it's a term that if I were to articulate, my audience can know what I'm talking about. It's a term that, because we didn't have it readily available on people's minds, delayed how quickly it is we've gotten to this place where we are talking about these different forms of injustice. So I'm glad that the term exists and does the job that it currently does in the world, in that it just allows certain conversations to happen. If you're doing something to me and I say it's colonial, you know what I mean immediately. And then we can then talk about specifics. When the term wasn't there, it was harder. And a good a good analogy for that kind of function was how I think Frika herself talked about interpretive marginalization. Whoever this is. Talked about interpretive marginalization. And she gave the example of the term sexual harassment. That before the 90s, when that term became available, it was much more difficult for women to articulate what had happened to them. It was more difficult. But with the term being available, you can just say, I've been sexually harassed. Then we can talk about the specifics, but you know what I mean once I've said that. And I feel like that's the kind of job that the term decolonization is doing. Now, my goal, my aim, is that we move into the space of greater specifics and also having the term to articulate more specific things, hence the kind of work that I'm doing, right? So to say, we have that, but how do we articulate its more specific manifestations? How do we articulate that to change those manifestations, right? That's, for me, the phase of work that we should be getting into now that we have that term. We can sort of ride on the back of it to more specific places. That's how I feel about it.
So to build off of what you just said in terms of terms, you know, for specificity to, you know, acknowledge and define something. What, I guess, where do you then intervene to move it away from just terms and discourse? Because I feel like a lot of these topics have become very theoretical. You sit in rooms, you have these conversations, you sound smart, you look informed, but then that's where it stops. There's no action. So I like that you said, like, you move it to action, but doesn't that require some type of concerted effort, some type of engagement, some type of I don't want to use the word violence, but you need to be kind of aggressive about it, because then you risk just now, to Perigia's point, people using terms that they like weren't using before, but now they seem so informed. BIPOC, decolonization, microaggression. It's like, okay, you all know the words and the terms, but nothing. We just continue having intellectual discourse, but not as enough action. So what is it going to take, and what do you need to do to push it out of just dialogue and refining syntax and semantics?
The way I think about that, and this is part of my early reflections on the decolonizing global health, what we call movement, but I prefer to call movements. I prefer to make it plural. And the reason why I've always insisted on the plurality is that we all often mean different things when we say decolonization. And often what we mean depends on where we stand in the world, right? So if I was saying decolonization in Nigeria, I would mean something very different to if a South African was saying it, or an Indian was saying it, or an indigenous Australian was saying it. So each movement, as it were, means something different. Now, because I live in Australia, and I think this part of this reflection is because I live in Australia, and I often say that the most powerful and effective people talking about decolonization in the space of health that I know are indigenous Australians. And I observe them and I learn from them. And I'm not part of their discourse. I'm on the edge of it, and I pay close attention. And that's how I wish we thought about decolonization more broadly. That each group of people and each type of interest is clearly articulated, and there is a group of people fighting for it. And so what I would ask you and others is, what is that thing you want to see changed, right? Or what is the sphere of influence that you want to change something in? And then I would say, what's the frame of your collective action? Who are the people you want to include in that movement? And I would say, what are the strategies you're going to take to find them and build a movement and make that thing happen? Now, as a Nigerian, what bothers me the most is that our health and care system is just so absolutely colonial, right? The first medical school in Nigeria was built to be as much as the one in London as possible. In fact, it's found in documents. It says that we want to be able to train doctors who can work in London. And the teaching hospital that was built, UCH in Ibadan, was built, it's a copy and paste version from the UCH in London, right? And one was built to serve a certain kind of Nigerian. And our health and care system has continued to be that. So when we talk about equity and all the things we talk about, for me, if you're not talking about the colonial origins of the system, we won't address those things. Primary health care, contextually informed care systems that build on traditional and indigenous knowledges are still on the surface. So for me, as a Nigerian, that's what I care about the most. Now, if I was an African American, I would care about other things. And I'll be looking to build a coalition of people who care along with me, and those exist. So for me, that's how I think about this. That all of this discourse is, for me, to the extent that they're important, is to give us a language, help us find like minds. But we can't do more than that. We can't. If I find two more Nigerians who care about the same thing I care about, it's like, you're in church and you converted new souls, right? And that's enough. One soul a month is worth a church congregation. And that's how I think about this. I'm looking for converts. And I hope, again, that other people are looking for converts too. But we can't demand of this discourse more than it can do. The people who fought for decolonization, especially in Africa and the African diaspora, they were fighting, like proper fighting, and writing books about it, or writing essays about it. And that's how I think about this. That the essays, a lot of what personally I write, it's a version of that. And I'm in the trenches doing other things. And to the extent that I served as editor of a journal for the number of years that I did, I counted that as part of my activism in this space, right? And I would hope that others will do similar things. And I know others are doing similar things. And I've learned from others doing similar things. So that's how I see this. I don't think we shouldn't put the burden of action on a discourse like this. If anything, the discourse learns from the action, right? And then spreads it. All that thereof.
Thank you so much for your brilliant presentation. I feel like this is an awakening message. And in this room, we have many students, future public health practitioners, and researchers. So I would say that at this time, we all have our implicit message or takeaway message from your presentation. My question is, do you have one explicit message for all of us? Because I don't want to go home and start thinking of this. I see question that you have something in mind. Trying to make an explicit message for us to
My goal was to make you do exactly that, so that you're thinking about it more and you don't feel like, because see, for me, there's always the danger of reducing all of these things to bullet points or take-home messages. And as I was sort of alluding to earlier, each of you has heard a different thing, right? From what I've said, when you give a talk like this, each person is interpreting it from their standpoint. It's making sense of it, how it applies to them. And for some people, it's clearer what this says. For other people, it requires a bit more thinking and interpretation. So if there's no message, it is think a lot more about it. And you would find again, as she was saying, you'd find purpose for action. And if you find purpose for action, you find hopefully others who feel the same way. And then you can act together. Now, this analysis that I presented is, I had to include the conflict of interest statement in this paper. Like I know these people. I'm one of these people.
Yeah.
These are my people that I'm analyzing. But it's part of that community, in essence, that has formed in the last few years of people saying this kind of things. People building curricula now. People building short courses now. People building advocacy to different kinds of entities, funders, universities and institutions, and getting pushed to do things differently. There are different movements and sub-movements that have emerged from institutions. The London School has a powerful movement that is holding that institution, seriously, for example. And there are others like that. So again, for me, it's where you stand, would you tell me what you want to change? And if it is within UW that you think there's something that needs to change here, figure that out, find like minds, and start to disturb them.
Yeah.
Yes, Patience.
So I do have a question, because I was reading this paper, and one of the conflict of interest that you mentioned was that you, being the chief editor-in-chief for BMJ, you actually reviewed some articles that you had written yourself.
Yeah.
And some of those articles you wrote them like years ago. So I want to know, like, when you did that analysis, is there anything that has fundamentally changed over the years that at least you can acknowledge that we've moved forward, or at least we're making progress?
Okay, so before that final few words, I thought what you were asking me was, have I changed my mind? See, for me, I think that one of the things that made me happiest in my time as editor of BMJ Global Health was that PLOS Global Public Health happened. And up until that time, I had this, silent concern that if they fired me tomorrow, what's going to happen, right? And editors are regularly fired. It's a very precarious position to hold because you can easily offend powerful people. And I did not mind offending powerful people. So it's always in my mind that someone's going to ask me to leave this position one day. And I wish that there were alternatives. And I was happy when that journal happened. I was also happy when Lancet Global Health started to do this work too. And they've done, to their credit, Lancet Global, not Lancet itself, because Lancet itself is, but Lancet Global Health. I've been happy that they've really moved, they've come a long way. And PLOS GPH is moving the field even further. And I'm happy about this. That, there were things that you couldn't predict 5-6 years ago. And you can sort of see things shifting. Again, these are, if we are going 100 miles, it's perhaps mile number 1 or 2. It's like it's very early days, but it actually shows some movement. In terms of whether what has changed in my mind, I think I've come to appreciate the need to decentralize knowledge platforms more. I think about 6 years ago, I wasn't thinking about that as actively as I do now. That no matter how inclusive a Lancet or a BMJ Global Health or a PLOS Global Public Health is, no matter how inclusive they are, they can't replace a space like India or states in India, or a space like Nigeria or Rwanda having its own platform that serves its needs, right? I think I came to that more recently. than when I started to be involved in this discussion.
Memo hands shake.
Yeah, let's see you first.
My name is Yang Fang Su. I'm an assistant professor of global health. And I really resonate with your talk regarding sense making. For example, if there's anything from the outside of my work, and then they took initiative, I need to first ask the question, does it make sense for me and the community? But I'm also thinking a bit further regarding like the source of legitimacy. That is a kind of like more academic word for sense making as a lay language. So in your understanding, what are the source of legitimacy in global health? In my understanding, for instance, like in religion, people will say the source of legitimacy would be from God or God.
From where, sorry?
From God.
God, Mr. God. Okay.
The demographic for commercialized world, actually the sense of legitimacy is really from our votes politically, or like even from credit cards commercially. And then maybe in the AI world, the sense of the legitimacy will be from the algorithm. So we'll say, oh, from the large model, it has been determined. So I want to hear your thoughts regarding your understanding about the source of legitimacy and sense making.
Now that's a rich question. And it's made me think about lots of different things as you were asking it. There is something I was appealing to. You may have picked it up in my talk, which is this sense of all of us human beings as equal and deserving of equal respect and dignity, right? Now, if this was a philosophy talk, a philosopher would spend all the time trying to make a case for where that came from. And whenever I've given a talk like this to philosophers, they wanted to talk about that. And I've often said to them, look, I don't care about where that came from. What I care is what we do because of it. Because we can't truthfully argue with ourselves that we are not all equal. Now, if that's an argument a person wants to make, you can make it, but I won't be interested. Right. But I take your point that where do we derive legitimacy? Now, there is this interesting thing. When I was being a public health official in Nigeria, but also as a medical student, whenever we wanted to say that something is legit, we say it's WHO. WHO said. Now, the closer you ask WHO, the more you see that it's all, you know, like there's nothing really going on there. But if you're in a place like Nigeria, WHO said, and so again, it's how flimsy, how fickle our idea of legitimacy is. I often make this joke that because I got into academic editing very early in my career, I lost my respect for that whole machine, right? So when someone says it's been peer reviewed, like, oh, I know how this thing is made. So again, for me, it's every potential source of legitimacy. It's constructed, right? It's not like it's real. It's constructed, and whatever is constructed can be deconstructed, right? Often, the more you understand that construction, the more you see through it. Yeah. I hope I've answered your question, but it's a very long. It's a complex question.
Yes, last question, please.
Yeah, I'm struggling to frame this, but so we talked about students needing to be brave, finding like-minded people, universities playing a part if they're not, students holding the university accountable. And we're seeing that happening in this country right now. But I'm just addressing that, like, what's happening as a result is students are getting arrested, students are scared they get deported, university presidents are getting fired. When I came to this country, it was like 2020, the Black Lives Matter movement, and I was very inspired, like, you know, like people coming together, people fighting. But right now, even saying something like war is bad, getting people blamed, getting people arrested, and private universities are being attacked now. Like, you know, government is interfering in private universities and firing them, not in government universities. So what do you envision for universities, as a center, as an ecosystem going forward to shield them to like still promote free speech, liberation, also respect for all religions, all culture, all faiths, but having a healthy conversation forward. Like Black Lives Matter wasn't supposed to be an anti-white movement. It was supposed to be like, a fair, just movement. And similarly, what's happening right now, it's not anti-Semitic, it's like, pro-humanity, if I may say. So how can universities like reposition and be shielded from higher influences, which like, I can't even think of.
Very similar to the question I was answering earlier. Growing up in Nigeria, one of the things you learn is that America is the land of the free and home of the brave, right? And this country loved freedom and people love liberty. And then you get lines from Jefferson and Washington and how great this democracy is. And again, the closer you are to it, the more you see that it's, it's not really so. And when you think back at the, I feel like this country had a lease of life in the late 60s with the Vietnam movement, which is what's going on, what I've read and seen about that period feels very much like what's going on now. And my hope for it is that it resets certain things. Yeah, that's my hope for it. That we are sort of jolted, not we, you, I'm not from here, that you are jolted out of that complacency of we love freedom and we are free, and people's hypocrisies about claims for wanting freedom of speech. Because people talking about freedom of speech, a year ago, are the ones clamping down on freedom of speech today, right? And just shows the lie, gives the lie to whatever it was they were talking about a year ago. I hope that knocking ourselves off of that hypocrisy and complacency can take us into a different place. And I'm really hopeful on that account that Gaza and Palestine and what Israel is doing there will re-energize our consciousness about freedom and what it really means to be free. Because I think it's hard for me to look at the images. I've shed many tears just looking. And if we can, as a people, get ourselves to a place where we either look and can't feel anything, or we've disciplined ourselves not to look. There's something about our soul, collectively, that needs reawakening. They say, sorry, I'm talking too much, but I gave a talk 2 weeks ago at Northwestern. Part of my visiting professorship there is to give a public talk, and the public talk was about famine. And I was drawing lines between the famine in Bengal in 43 and the famine in Gaza now. And I was making an epistemic argument about it. That one of the defining features of famine is that it's an extreme state. Right? Because if you look at the things that define famine, things have to have been extremely bad for people to get there. And if you read Amartya Sen's work on the Bengal famine, one of the arguments he makes is that the reason why that famine happened was because the British colonial government was so far away. And the media ecosystem that could ensure the connection that would lead to responsiveness was censored or self-censored because it was owned and controlled by the British. But for me, the bigger lesson of Bengal and of Gaza is that while Sen would make the argument that democracies prevent famine, my sense is always that even if that is true, right, the things that lead up to a famine, democracy doesn't prevent. Right? And those things that lead up to famine, the hunger, malnutrition, and starvation that lead up to famine, kill far, far many more people in the world than famine does. And they kill far many more people in the world because we, different communities in the world, have learned to not look. right? Because in democracies, there are hungry, malnourished, starving people in our midst all the time. That we've trained our eyes not to see, right? Whether as people who analyze things and talk about health and equity, or as the media that is in a position to speak, that we've trained our eyes not to see. And for me, if we can't address that, then we can't address famine. Neither can we address wars. Now, bringing that to Gaza, whatever happened on October 7th, evil as it is, was preceded by decades of evil against Palestinians. Again, in many instances, we learn not to see that, even though the power that allows that to happen stems from here, right? And what has happened since October 7 in Gaza, we've also been encouraged very actively not to see. So there's a part of me that's very happy, although it's taken a few months, that young people, as the young people did in the 1960s in this country, seem to be finally energized. I'm happy that the government of this country and the administration of the universities feel strongly enough that they need to clamp down on them, because that suggests to me that there's an impact there, there's a fear of what they may achieve. So I'm hopeful and I'm optimistic about what may yet happen in this land of the free and home of the brave.
Thank you very much. Go, Shidon. Your time don't pass. Thank you all for coming. All the applause have to go to you. Give a round of applause to yourselves for being out this late, and this is your dinner time and your studying time. I'm really grateful for you coming out and honoring this invitation. There are a lot of people. I want to thank the DEI committee. James, thank you for the guidance and the leadership through this. Angeli, for always asking me if Shay is around and calling me when I'm at home and having dinner with Shay last night. Thank you for the reminder and for coming out. Letty, you are a star. Thank you for putting this together and helping me to also put this thing together. Leah, you are a darling. You've been there helping and guiding me through the things I don't know about where to find what in this process. And to my co-chairs, Anya and David, who also supported me in putting all this together, and Monica, who's also part of the communications committee. I'm really grateful for the support, and I am happy that I could convince Shay to come, because it took a lot of convincing. Even though I went to his house, he didn't say yes. He did not say yes. He said he would think about it. And I can remember when I used to ask girls out and they said they were thinking about it. It meant no. It meant no. So that was the framework that I had in my mind, that he's saying no. So I kept pestering. I had his WhatsApp number. That was, if a girl gives you his number, her number, okay, there is some hope there. So he gave me his WhatsApp number. I kept pestering him, and here he is. Thank you all, and have a wonderful evening.